I now invite our Registrar, Dr. Rajesh Darade, to please guide the students for their future.
Good afternoon, everyone. Myself, Dr. Rajesh Darade, Registrar of CPS, welcome you all for the 151st Convocation of College of Physicians and Surgeons of Mumbai. Respected President of CPS, Dr. Girish Mandarkar. Today's guest of honor, Dr. Ambedkar sir. Guest, Dr. PM Zadav sir, our mentor. Professor Dr. Batra sir. Dr. Bakul sir. Vice President Dr. Venkatesh Giri. Dr. Kavita Mandarkar. Deputy Registrar of CPS, Dr. Naresh Alreja, Control of Examination, Dr. Jassawala, all the honorable council members, all the dignitaries in the hall, and all my dear students. First of all, I would like to congratulate you all students who are present today and all other students who are taking degree in absentia for passing respective degree and becoming consultant in the respective specialty. Dear students, up till now, you are working as a resident doctors in the concerned hospitals, and you are protected by the senior doctors, your teachers, and the institution heads. That means you are protected by these people. Henceforth, after this degree, you will be independent consultant and responsible for the management of your patients. Therefore, you have to work with more responsibility. Ethics is an important part of our practice. You all should do ethical practice. You should be loyal to your patients and your colleagues. Communication is the important aspect of our practice. You all should learn how to communicate with the patients and patients' relatives. This is going to reduce more than 80% of your litigations in the practice. Explain all the steps in detail, like procedures in detail to the patient and the relatives, what you are going to do on the patient. Take consent. This is also very important. Consent in writing and not the verbal consent. Also, the record keeping, that is indoor and the OPD record keeping, as an important part of the good and ethical practice. You should keep all the papers updated, consent, procedures, any complications. All these things has to be mentioned on the paper and it has to be recorded. We don't know which patient is going to sue in the court of law. So there are guidelines how long to keep the records of the different specialty and also the reporting. Now, daily and monthly reporting to the competent authority is important part of our practice. This is compulsory for everyone, especially for the radiologists and the obstetricians and gynecologists because they are involved in their sonography. Display of all your degrees and all the permissions in the OPD at a visible site is very important. Display all your rates. That is, nowadays they ask for the rates, OPD, minor, and major procedures and all the operations. Friends, you have to develop yourself gradually to acquire good skills in the subject. For example, surgeon or the gynecologist doing simple procedure initially becomes competent and does more complicated surgery over the period of time. That means he develops a competency in that particular subject. And this holds good not only for the surgical branches, all other branches also. If you think any patient is complicated, take help of your seniors and refer to the higher center and to the person who can manage these cases very well. In short, you should know your limitations when you are doing a practice. All the people sitting on the dais, including me, are the product of CPS, and I've gone through all the stages to reach this level. Many of our students are really doing, as mentioned by Dr. Venkatesh, they are leading practitioners in taluka and district places. Also, few students are doing very good job in the foreign countries as well. So dear students, if you are sincere, hardworking, and doing ethical practice, no one can stop you from your practice and the progress. So once again, I congratulate you all and wish you all the success in life. Thank you. Jai Hind, Jai CPS.